Welcome to the deep dive. Today we're tackling attention deficit hyperactivity disorder, ADHD.
Mm-hmm.
Think of this as your kind of streamlined guide. We want to help you understand it inside and out.
Yeah, absolutely.
So whether you're maybe prepping for exams or trying to get a handle on a diagnosis or you just want a clear overview, we're here to, pull out the most important bits from our sources.
Right, cutting through the noise a bit.
Exactly. Our mission is to define ADHD clearly, look at what might cause it, who's at risk, how it actually works in the brain.
What else it might look like?
Yeah, the differentials, how common it is, what the features are, how it's diagnosed, managed.
The outlook, potential problems, all that stuff.
All based on the info we've gathered for you. So let's get started.
Okay, so to kick things off, what exactly is ADHD? Fundamentally, it's a neurodevelopmental condition.
Meaning it relates to brain development.
Exactly. And the key thing is this persistent pattern of difficulties with inattention, hyperactivity, and impulsivity.
And these aren't just like occasional things?
No. They have to significantly affect someone's daily life, their functioning, their development. And it's not just a childhood thing either.
Yeah.
Symptoms usually start young, yeah, but they can definitely stick around into adulthood.
Right. Okay. So when we talk about inattention, what does that actually look like? Our sources mention the DSM-5 criteria.
They do.
Yep.
So think of it as real trouble focusing. This can be things like missing details in work or schoolwork, finding it hard to keep attention on tasks, or even play.
Like seeming not to listen.
Yeah, exactly. Seeming not to listen even when you're talking right to them. Not following through on instructions, having trouble getting organized, the messy desk, unfinished projects.
Avoid stuff that takes mental effort.
That too. Often loses things. They do keys, glasses, homework, easily sidetracked, forgetful in daily activities. For kids, you need 6 or more of these.
And for adults.
For adolescents and adults, it's 5 or more.
Okay. And then the hyperactivity and impulsivity side. Similar idea.
Yep. Similar numbers, 6+ for kids, 5+ for older ones. Hyperactivity might be fidgeting a lot, tapping hands or feet, squirming.
Leaving their seat when they shouldn't.
Right. Running or climbing when it's inappropriate. For older people, it might be more like feeling restless inside, struggling to play or do leisure activities quietly.
The driven by a motor description.
That's the one. Often talking excessively, too. And then impulsivity that's acting without really thinking it through.
Like blurting out answers?
Blurting out answers before the question's done, yeah.
Yeah.
Having trouble waiting their turn, interrupting conversations or games.
So it's this collection of behaviors, but like you said, it's not just having a few of them. There are other conditions for a diagnosis, aren't there?
Absolutely crucial point. For it to be ADHD, these symptoms need to have shown up before age 12.
Okay.
They also have to be present in 2 or more settings, so not just at home, but maybe at school or work too. And critically, these difficulties have to genuinely interfere with their life, their social life, their schoolwork, their job performance.
And it can't be something else.
Exactly. The symptoms shouldn't be better explained by another mental health condition, like anxiety or a mood disorder or, something else entirely.
Got it. And our sources mention different types or presentations of ADHD.
Correct. There are 3 main ways it can present. You've got the combined presentation, that's where someone has significant symptoms of both inattention and hyperactivity impulsivity.
Okay.
Then there's predominantly inattentive. Here, the main struggle is with focus, organization, forgetfulness, but without much of the hyperactivity.
Right.
And finally, predominantly hyperactive impulsive. So the main issues are being overly active, restless, acting without thinking, but attention might be relatively okay.
Which one's most common?
Our notes suggest the combined type is actually the most common. Maybe 50 to 75% of cases fall into that category.
Okay, that really helps define it. Now, let's shift gears a bit and dig into the why. What do our sources say about the etiology, the causes?
Well, it's pretty clear that ADHD is multifactorial. There isn't one single cause.
Right.
Genetics and family history play a really big role. Twin studies show it's highly heritable. If you have a first-degree relative, a parent, or sibling with ADHD, your risk is definitely increased.
So a strong genetic link. What about, like, environmental factors?
Yeah, there are several environmental things that seem to increase risk. During pregnancy or around birth, things like low birth weight, being born preterm, or the mother smoking or drinking alcohol during pregnancy.
Okay.
Also, certain health conditions, maybe like epilepsy or if someone's had a significant brain injury.
Toxins, I think I saw that mentioned.
Yeah, lead exposure is one that comes up. Even nutritional factors, potentially iron deficiency.
Interesting. What about social factors?
There's some link mentioned with children who are looked after, meaning cared for by non-parents. And maternal factors, too, like the mother's mental health during pregnancy or substance misuse.
Wow. Okay, so it's a real mix of potential influences and coexisting conditions.
Yes, ADHD very often occurs alongside other conditions,
Yeah.
other neurodevelopmental disorders like autism or mental health issues like anxiety or depression.
Which might suggest some shared pathways.
Potentially, yeah. And neurologically, the thinking involves possible differences in brain structure and function, and particularly problems with how certain neurotransmitters work.
Neurotransmitters, the brain's chemical messengers.
Exactly, especially ones involved in attention and impulse control. So the exact cause isn't fully pinned down, but it's definitely a combination of these genetic and environmental factors interacting.
Okay, so recapping the risk factors then, it sounds like it's largely those things we just discussed.
Pretty much. Key things to remember are family history of ADHD or other mental health stuff,
Hmm.
those prenatal factors, smoking, low birth weight, alcohol, lead exposure. It's that mix of genetic vulnerability and environmental hits.
Got it. So let's zoom in a bit on the biology. What's the pathophysiology? What's actually going on in the brain based on what we know?
The main theory centers on dysregulation of key neurotransmitters, primarily dopamine and norepinephrine.
And those are important for.
Really crucial for things like attention, focus, motivation, reward, and executive functions. Planning, organizing, controlling impulses.
Okay.
There also seems to be less efficient communication, perhaps, between certain brain regions that manage these functions, areas like the prefrontal cortex, basal ganglia, cerebellum. Think of it maybe like the network connections for attention and self-control aren't quite as strong or fast.
Right, like a slightly less efficient signaling system for those specific tasks. That helps. Now, super important question. If someone presents with these kinds of symptoms, what else could it be? What's the differential diagnosis?
Yeah, this is critical because symptoms can overlap with lots of other things. A specialist needs to rule these out.
Like what?
Well, thyroid problems can sometimes cause issues with energy and concentration. Anxiety disorders are a big one. Anxiety can make it really hard to focus.
Mm-hmm.
Depression, too, can look like lack of motivation, difficulty concentrating. Bipolar disorder needs consideration, especially thinking about impulsivity and energy shifts.
Okay.
Autistic spectrum disorder, there can be overlap in social communication and sometimes attention patterns. Certain personality disorders might involve impulsivity.
What about in kids specifically?
Definitely oppositional defiant disorder, ODD, and conduct disorder. They involve challenging behaviors that can sometimes look like ADHD's impulsivity or hyperactivity.
Mm-hmm.
Psychic disorders, like Tourette's, fetal alcohol syndrome can cause similar cognitive and behavioral issues.
Then in older individuals?
Substance use disorders are important to consider. Drug or alcohol use can significantly impact attention and behavior.
So a really careful assessment is needed to distinguish ADHD from all these other possibilities.
Absolutely essential.
Okay, let's talk numbers. How common is ADHD? What does the epidemiology tell us?
Right. So in the UK, estimates are around 5 to 8% of children and young people have ADHD.
And it's more common in boys.
Yes, the diagnosis rate is higher in boys than girls, roughly a 3-to-1 ratio, though that might reflect differences in presentation or referral bias sometimes.
Interesting. Does it vary much?
Yeah, prevalence rates can vary depending on the exact diagnostic criteria used, the age group studied, and how the assessment is done. Globally, the estimate for children is often cited around 5%.
And the age of diagnosis?
Typically between 3 and 7 years old is common, but it absolutely can be diagnosed later, even into adulthood.
And we mentioned earlier the combined type is most common.
Yep, that combined presentation seems to be the most frequent diagnosis.
Okay, so let's bring it back to the individual experience. What are the key clinical features someone might actually show day to day?
They map directly back to those criteria we discussed. So, inattention. You might see someone really struggling to stick with tasks, homework, chores, even fun activities sometimes. Poor organization is classic: messy backpacks, lost papers, trouble managing time.
Like constantly losing things.
Yeah, losing things needed for tasks, being forgetful about appointments or chores. For hyperactivity, lots of fidgeting, tapping, squirming, difficulty staying seated when expected to, like in class or during meals.
Feeling restless.
Exactly. Often feeling restless or described as being on the go or driven by a motor.
Mhm.
And impulsivity, acting without thinking. Maybe interrupting others frequently, difficulty waiting their turn in games or cues, blurting out
That
answers.
sounds quite variable, though.
Hugely variable. How these symptoms manifest and how severe they are differs a lot from person to person, and they can change over time too, maybe hyperactivity lessens with age, but inattention persists.
Right, not a one-size-fits-all condition at all. So if ADHD is suspected, how do clinicians go about investigating and confirming a diagnosis?
Okay, so first off, our sources stress this should be done by a specialist.
Like a psychiatrist or pediatrician?
Yes, or another healthcare professional with specific expertise in ADHD.
Yeah.
It's not usually a GP diagnosis, though they'd make the referral. The process itself is really comprehensive.
Not just a checklist, then.
Definitely not. It involves taking a detailed clinical history from the person and, if possible, from family members or partners. A psychosocial assessment looks at their environment, social situation, stresses.
Development history, too.
Crucial. A full developmental and psychiatric history, any past issues, family history, and really importantly, getting observer reports. For kids, that means detailed feedback from parents and teachers.
Using questionnaires.
Often, yes. Things like the Strengths and Difficulties Questionnaire or Connors rating scales can be used to gather standardized information and track symptoms over time. It'll also be a mental state assessment.
And looking for those other conditions we talked about.
Exactly. Evaluating for coexisting conditions is key. They also assess the person's social circumstances, family life, school or work situation, and their general physical health.
And the impact.
That's the core of it, really assessing how much these symptoms are actually impacting their daily life, their relationships, their ability to function at school or work, and their emotional well-being. It's about the impairment.
Sounds incredibly thorough. So once a diagnosis is confirmed, what does management look like? What are the main approaches?
Management is usually multimodal, meaning using several strategies together. It typically involves education, behavioral interventions, sometimes medication, and ongoing support.
Is there a standard pathway?
Sort of. Nice guidelines suggest, for instance, in children with milder symptoms and less impact, a period of watchful waiting might be considered first, maybe with some group-based support offered.
Okay.
But if the symptoms are causing moderate to severe impairment, then a referral to a specialist service is usually the next step. For adults seeking assessment, it's generally a referral to a mental health specialist.
And what are the sort of general principles guiding that management?
Well, a big part is explanation and support, helping the person and their family understand ADHD, providing good quality written information.
Highlighting positives, too.
Yeah, it's important to discuss potential positive aspects, like maybe creativity or high energy when channeled well, and reducing stigma. Discussing how ADHD might affect different areas, education, work, relationships, even driving eligibility.
Liaising with schools seems important.
Definitely. Collaboration with schools or colleges is often vital for putting strategies in place. Encouraging a balanced diet and regular exercise is good general advice.
What about specific diets, like cutting out additives?
Generally, the guidance advises against broad elimination diets, unless there's a clear, specific link identified for that individual, perhaps through a carefully monitored food diary. It's not a first-line approach.
Okay. And medication. That's often a big part of the conversation.
It is, and it can be very effective for many people.
Yeah.
But it needs to be initiated and managed by trained professionals, usually specialists.
Who gets offered medication?
It's typically considered for school-age children, adolescents, and adults if their ADHD symptoms are causing significant impairment despite other strategies.
What's usually tried first?
In the UK, methylphenidate, that's Ritalin, Concerta, etc., is usually the first-line option. If that doesn't work well or causes difficult side effects, other medications like lisdexamfetamine or atomoxetine might be tried.
Are there checks needed before starting?
Yes, a baseline assessment is essential. Checking pulse, blood pressure, height, and weight, especially important for monitoring growth in children. Sometimes an ECG might be done too.
And it follows guidelines.
Strictly. Prescribing should always adhere to NICE guidance. And if things are complex or not responding, referral to a more specialized tertiary service might be needed.
So it's carefully managed. Is there follow-up?
Constant follow-up and monitoring are key. Once someone is stable on medication, often a shared care agreement is set up with their GP for ongoing prescriptions and monitoring.
But regular specialist reviews, too.
Yes, regular reviews are needed to check effectiveness, monitor side effects, growth, blood pressure, pulse, and overall well-being.
And you mentioned behavioral and psychosocial treatments. What do they involve?
These are really important, often used alongside medication or sometimes as the main approach, especially in younger children or milder cases.
Like parent training.
Exactly. For preschoolers, group parent training programs are often recommended first line. They teach parents strategies to manage behavior. Group support for parents and older children can also be helpful.
And in schools.
Behavioral interventions in the classroom can make a big difference. Things like structured routines, clear instructions, seating arrangements, reward systems.
What about therapy like CBT?
Cognitive behavioral therapy, or CBT, can be useful, particularly for adolescents and adults, or younger people still struggling despite medication. It doesn't cure the core ADHD, but it helps develop coping skills.
Skills for what?
Things like improving social skills, problem solving, managing anger or frustration, improving listening skills, learning to express feelings appropriately, better organization, and time management.
And for adults specifically, non-medication options.
Yes, things like structured supportive psychological interventions, often based on CBT principles, are recommended. Regular follow-up is key for adults too.
So just to reinforce, medication is part of a plan managed by specialists. Diet changes aren't usually the first step. Regular physical checks are vital, caution with certain meds and driving, and ongoing specialist reviews.
That's a great summary. It's a comprehensive, ongoing process.
Okay, so looking ahead, what's the prognosis? What's the long-term outlook for someone with ADHD?
It's quite varied, actually. With appropriate management and support, many individuals with ADHD lead very successful and fulfilling lives. Early intervention definitely improves outcomes in terms of attention, behavior, and school performance.
Does it always persist into adulthood?
Not always, but often it does, at least to some degree. While hyperactivity might lessen, challenges with inattention, impulsivity, organization, and maybe social interactions can continue.
Is there data on that?
Yeah, there was a big meta-analysis back in 2006. It found that by age 25, about 15% of people diagnosed in childhood no longer met full criteria for ADHD. However, around 65% still had persistent symptoms causing some level of functional impairment.
And comorbidities matter, other conditions.
Hugely. As we mentioned, ADHD often co-occurs with things like ODD, conduct disorder, substance misuse issues, mood disorders like depression or anxiety, autism, learning difficulties like dyslexia or dyscalculia, and motor coordination problems like dyspraxia.
So the prognosis depends on those too.
Absolutely. The severity of ADHD itself, plus the presence and management of these coexisting conditions, significantly impacts the overall long-term picture.
Are there other associated risks if it's not well managed?
Unfortunately, yes. Untreated or poorly managed ADHD in young people and adults is linked with higher rates of self-harm, accidents, substance misuse, delinquency or involvement with the justice system, anxiety disorders, and academic or occupational underachievement.
So management isn't just about symptoms now, it's about long-term well-being and reducing these risks.
Precisely.
Which leads us naturally to complications. If ADHD isn't well managed, what are the potential difficulties people might face?
Well, building on what we just discussed, academic challenges are a major one. The attention difficulties can make learning in traditional settings really tough, leading to underachievement or needing extra support.
Socially.
Impaired social relationships can be a big issue. The impulsivity, interrupting, difficulty reading social cues, perhaps, can make it harder to form and maintain friendships and relationships.
And self-esteem.
Yeah, unfortunately, repeated struggles academically and socially can really knock someone's self-esteem and confidence over time.
Risk of accidents.
That's another one. Due to impulsivity and sometimes inattention, there can be a higher risk of accidents and injuries, driving accidents, workplace accidents, etc.
And the link to other mental health conditions.
Yes, a significantly increased likelihood of developing coexisting conditions like anxiety disorders, depression, and particularly substance use disorders. People might self-medicate or struggle with impulse control around substances.
So, again, it really underlines the importance of getting that timely intervention and ongoing support.
Absolutely. It's crucial for mitigating these potential complications and helping individuals reach their full potential.
Wow. This has been an incredibly thorough deep dive into ADHD. We've really covered a lot of ground, defining it, causes, risks, biology, a diagnosis, the whole management piece, and the long-term view. The key takeaway for me seems to be just how multifaceted it is and how vital that comprehensive, personalized support plan really is.
I agree. Understanding all these different aspects and the importance of early, consistent support is absolutely essential for improving outcomes for individuals and families affected by ADHD.
Right. Well, on that note, here's a final thought for you, our listener, to mull over. How might a deeper understanding of neurodevelopmental conditions like ADHD change how we build support systems in different places, like schools, workplaces, or even within families? Something to think about.
Good question.
And if you found this useful, maybe for revision or just general knowledge, do check out pastthemsra.com and freemsra.com for more resources, especially if you're prepping for exams.
Definitely worth a look.
Thanks so much for joining us for this deep dive today.